Hello, everyone. This is Dr. Stephen Loam, cardiologist at heartstrong.com and founder of pbnm.org. And I'd like to have a Facebook Live session here today to discuss simply how it is that I like to talk to people about plant-based diets. And I think this is super, super important to know because not only are there a lot of misconceptions out there, but we really all need to individually be very strong, powerful advocates for plant-based diets. And it's important for us to know all of the different facts about them so that we're communicating effectively and different answers to questions that people might have when they're talking about plant-based diets. Everybody's going to come from a different, unique perspective. But the one thing that we know is that a whole food plant-based diet not only is a cure for heart disease, but can prevent and reverse many of our other chronic diseases. And it's such a powerful thing that we really, 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 truly need to effectively communicate this. And it can be a challenge. Some people are going to be very open to hearing these things, and some people aren't going to be as open. Now, coming from a cardiologist like I am, people are going to listen to me. I have credentials, especially if they're my patient, they're coming to see me, they're going to listen to me. But what about somebody who's not a healthcare worker? What about a person who, whatever, an accountant, and any other type of person that's not a healthcare worker, but they know the power of whole food plant-based diets, lifestyle medicine, and they see somebody that they know really needs to help and they want to help that person. How is it that we can effectively communicate to them these things without being too aggressive, without insulting people, without hurting people's feelings, and knowing that they are very preconditioned to eat animal foods, processed foods, they're following the culture, and we really want to educate them in an effective way so that they can make positive change. And I love to tell people straight out that most people listening here, they understand the power of plant-based diets and lifestyle medicine. And you are a person who can literally save other people's lives. You can, because you know how powerful it is. Help other people change to a hopefully exclusively plant-based diet, but even if not exclusively, at least a predominantly almost 100% plant-based diet, you could save people's lives. So how can we most effectively do that? So last week we talked about heart disease prevention and reversal, had some great question and answers afterwards. Let's do the same here this time, but we're going to talk about how we talk about plant-based diets and how I do this. I've been doing this now for a little bit more than 2 years. I've learned a lot of things, but I'm sure I'm going to continue to learn more and more. So any feedback that you have for me, I would really appreciate it. So that I can hopefully better, more effectively communicate to my patients and to other people how we do this. So first of all, I'd like to say that I know some people that I deeply care about, loved ones and close friends, and they follow very unhealthy diets, heavily animal-based. They have chronic diseases, high blood pressure, overweight, obesity, diabetes, high cholesterol levels, and I've tried to, gently communicate with them about the power of plant-based diets, but you can't be in their face. You really can't be. You have to. They'll be ready in their own time. Everybody will have their own aha moment, and really, you don't want to ever turn anybody off to the plant-based diet. You don't want to be too aggressive with people. Everybody will come to it in their own time. Plant the seeds, slowly let it grow, and it's hard. It's a struggle, but the absolute most important thing that you can do to help other people understand plant-based diets is to actually do it yourself and be a good example. What do they always say? Put the oxygen mask on yourself before you help other people with it. That's super, super important. So be the change yourself. Do it. Be a good example. Cook great food. Show them how much you love the food and enjoy the food. And if you do it yourself, that's going to be the most effective way. So if you're struggling, first of all, before we get into any of this stuff, if you're struggling with a loved one, a close friend who you just know or they're eating their way into chronic disease or heart disease, and if they're being resistant, first of all, you must be a good example yourself. So one of the biggest examples I see are people who are vegan for the animals and for the environment, which is great. That's wonderful, very respectful thing. However, as you guys know, a vegan diet isn't necessarily healthy if there's a lot of oils and processed food and sugar in it. And I see a lot of people who are overweight, obese, or diabetic. And those people might be preaching to other people about how great it is to be vegan or be on a vegan diet. But if they're not healthy themselves, if they're not taking care of themselves, that's a problem. we need to be a good example in all aspects of our eating so we can show other people how healthy we are, how much we're enjoying the food, how great it is. And then that is going to be how we can more effectively get other people to do the right thing. So let's get into the PowerPoint here. Let me verify the feed's working good. Looks like things are working well here on this end. Woo, that's cool. All right. So so let's get into this. So when I have a patient in front of me and I'm talking to them about chronic disease and I'm trying to get them on board, I love showing them some of these statistics, how huge of an impact heart and circulatory disorders are, which are 99% preventable: heart attack and stroke, clogging of arteries, atherosclerosis, cancer, predominantly preventable through diet and lifestyle changes. And when you look at in perspective the other disorders, it's huge. You know, 600,000 people died last year from heart disease. That's just about the same number of Americans that died in all wars in American history combined ever, yet it being preventable. It's important. And I tell people, especially if they don't already have heart disease, that the first symptom of heart disease in about 1 out of 4 to 1 out of 3 people, first symptom is sudden death. So we really need to work when you're young and healthy to prevent having an issue in the first place. So I share these statistics with my patients so that they really understand the impact of this. So that's usually the first way that I go. And so as we get into our discussion, I feel like a lot of times that we really have to people need to have the understanding, like, why is it that they got to this point in their life, and why is it so? Why is it that our society is set up this way? You know, if 600,000 people die every year from a preventable disease, and that's just heart disease, not to mention diabetes and hypertension and stroke and preventable cancers, I'd say this straight out to my patients, and I know this is a little bit rebellious, but it's important for people to realize that our healthcare system is not perfect. And don't fall into the trap of just going to your doctor, taking pills and keeping your fingers crossed that everything's going to be okay. That's not what you want to do. You need to take control of your own health. So I tell people, why do we let so many people die prematurely? It's culture and it's money related. That's just the way our culture is not into healthy eating and prevention. We're not physically active. And there's a lot of money in unhealthy people, right? There's no money in healthy people. That's just the way our system is set up. And so I say that straight out to people so that they realize that we have kind of all fallen into a trap as Americans, eating unhealthy food and then paying for these treatments, which don't really cure disease. They just prolong it. It's super important for people to understand that. You know, you watch a football game and they're advertising you fast food and junk food and processed food, followed by advertisements for drugs and hospital systems. And you have cancer, come here. You need a blood thinner, take this. So it's marketing. And so that's just kind of the way it is. And we need to step up and say, listen, we don't want to fall into this trap. So I tell people that straight out, that listen, we've kind of been duped as a culture. And a lot of people get that, but some people really haven't thought about this much. And so for people who have thought about it, they get it, and we need to go a lot further, which we're going to get into. But some people just are even blindsided just by that thought. So just getting that out there is an important thing. So, you know, we live in a capitalistic society where there's no money in healthy people, there's no money in dead people, the money is in sick people taking lots of pills, getting tests, surgeries, and procedures, and that's just the reality of our system. And so people see that, and I say, listen, don't fall into this trap. You don't want to be there. You want to do the right thing. And so I literally say, hey, let's try to figure out why it is that you're here in front of me. You're 300 pounds, you're a diabetic, you just had a heart attack. Why is it that you're here? Is it your fault? It's not really. I really try to get people to take their blinders off, because we kind of have these blinders on where we're raised a certain way with our culture and our food system, and we go and we go and we go, and we don't stop to think about this stuff. We just don't stop to think about it. So there are 5 factors that really contribute to people being overweight, diabetic, and obese. And I literally sometimes will pull up these PowerPoint slides and show them to people. That first is our human instincts. We love sugar, salt, and fat. That was an evolutionary mechanism so we wouldn't starve and die. Of course, we're not starving nowadays. We have an abundance of food, an overabundance of food, yet our palates are hyperstimulated with sugar, salt, and fat. So something called a motivational triad, important to learn about. Motivational triad is seeking pleasure, avoiding pain, and conserving energy. And the pleasure, what gives more pleasure on a daily basis than your breakfast, lunch, and dinner? Sugar, salt, and fat. We hyperstimulate ourselves. Avoiding pain, conserving energy, that's kind of like being sedentary, right? Conserving energy is being sedentary. And exercise, especially when you don't exercise a lot, you go out, you work too hard, it hurts. It hurts, so you want to avoid pain. So is that the fault of an individual American? it doesn't really seem to be an individual American's fault. So the second thing is culture. You know, the day you turn 1, you get a cake put in front of you. You're addicted to sugar. Halloween candy was my breakfast, lunch, and dinner for a week after Halloween when I was a kid. When you're born into that culture that everybody's eating unhealthy food and they promote unhealthy habits, that's not the individual American's fault. We need to change our culture. But I let people understand, listen, you were born into this. Is that your fault? No, that's not your fault. Our food industry feeds us processed food, junk food, sugar, salt, and fat, and they fund research to confuse people as to what's healthy and what's not. All the food industry, what they provide us, and they're confusing people, marketing, not the individual American's fault. Our government policies subsidizing feed for livestock and subsidizing sugar, not subsidizing apples. An apple a day keeps the doctor away, right? Where are the subsidies for broccoli? We should be giving beans away for free to people. That's what would have a major health impact on America, but we don't do that stuff. So not the American's fault. And then the food pyramids and the My Plates, which they're not really ideal. So that is not the individual American's fault. That's not what we should be doing, right? And then our healthcare systems, which we talked about, we don't get paid for prevention. We get paid for treatment, for productivity. And so you go see your doctor, they're going to hardly ever talk to you about nutrition, lifestyle, weight loss. It might be a little note at the end, oh, by the way, you should eat healthy, lose weight. Here's some resources. But really, as we talked about last video, that if the cause of death in America, the #1 cause, is actually the American diet. It's not heart disease, it's the American diet. So we should be talking about diet in every single doctor's visit, and it should be the most important factor that your doctor talks to you about. It really should be. And right now, and healthcare systems want people to be healthy. They do. They really want to do what's right for patients, but they must get paid for it. If they don't get paid for it, they're not going to do it. So we want to shift our healthcare system more towards a preventative model. So I let people understand this, hopefully taking those blinders off that they've had on their whole life, that this is why America is sick, and we really need to shift our system so that we profit off of prevention of disease and stop profiting off of promoting illness and sick care. You know, we don't have a healthcare system. The definition of the word health is a state of being free from illness or injury, which we don't do that. We don't cure diabetes or hypertension or heart disease. We put a Band-Aid on it and give pills and do procedures. But in a true healthcare system, we would restore health, which is the state of being free from illness or injury. We would get rid of it. So we don't do that. So we have a sick care system or a medical care system, whatever you want to call it. And so I actually make sure that people understand that. You know, intelligent people might get it immediately, and other people need a little bit of guidance to say, listen, take these blinders off. You need to take control of your own health. You have the most power over your own health destiny. You really do. And so cutting through all of the crazy research stuff, I always mention the blue zones, that the longest living cultures in the world averaged 95% plant-based. They had a good sense of family. They didn't smoke. They were physically active, socially engaged. At their ideal body weight, they ate tons of legumes and beans. All the longest living cultures did. And they were plant-based. But I say, hey, listen, these people were plant-based from the day they were born. You have heart disease already. You have diabetes already. You've already laid the foundation for cardiovascular disease, because we know clogging of arteries starts when you're really young. You can't just be 95%. That's why the data strongly shows 100% whole food plant-based is the way to go. And so I always mention those blue zones to people. And so when I'm getting into nutrition, I actually say straight out to people, listen, this is the simple concept of how we need to think about nutrition. There's only 3 food groups. It's the processed foods, which includes refined carbohydrates and oils. And yes, we've gone through that before. Oils are highly processed and unhealthy for you. There's the animal-based foods, and there's the whole plant foods. I show them the slide, and I take the time to make sure that they understand that carbohydrates are not all bad. There's good carbs and bad carbs. The complex carbohydrates from whole plant foods are phenomenally healthy. The longest living cultures in the world ever were high carb. Those blue zones are all high carb eaters from complex carbohydrates. But I emphasize how bad the white flour, the white sugar, white rice, refined carbohydrates are horrible for you. And then the animal-based foods, we know I give them the whole nutrition spiel. I give my patients right there in the office. A lot of times they're blindsided. They don't realize they're going to get a whole nutrition lecture, a little nutrition course in the office, but everybody needs to hear this straight out. Animal-based foods, of course, is where cholesterol and saturated fat comes from. Whole plant foods, 100% whole food plant-based diets recommended by the American College of Lifestyle Medicine. And that's what I recommend to my patients universally. Everybody can thrive on it. And so it's important to communicate that to patients. So when we're talking to patients about this, they're always immediately going to have, oh, what about this? What about that? They're going to have all these objections in their mind. You need to make sure that when the discussion is over, that there are no further objections in their mind. Once, if you really know the answers to all the questions that we're going to go through, the nutritional questions and the protein and all these other things, if you know all those questions and you answer them all, then you end the conversation with, so what's stopping you from changing to a whole food plant-based diet? And if they say, oh, this, that, whatever question they bring up, you should have the answer for, because there is an answer for everything, right? There is an answer for everything. And so you need to know those answers. The only argument against going on a whole food plant-based diet is just, I don't want to. I just don't feel like I want to. And it's like, well, why? Well, I don't care about my health, or I just don't want to take the effort. That's not good. That's not a good answer. I'm not saying it's a good answer, but that's really the only thing that stops people. If you can answer all their questions, put out all the myths, all their misconceptions, all their worries about nutrients and such, then the only reason why somebody wouldn't do it is they just simply don't want to. But if you guide them, show them how easy it can be, give them the resources and tools, hopefully we'll get a lot of those people to transition over to the whole food plant-based diet, which is super important. So all my patients, people I'm talking to, I explain it this way. And then this is the powerful statement. The American Academy of Nutrition and Dietetics, which is the largest nutrition association in the world, says straight out that a 100% plant-based diet is nutritionally adequate and appropriate for all stages of life, including pregnancy, infancy, childhood, adolescence, elderly, athletes. So you can get all the nutrients you need. And so I explain that to people. And we need to put out all these myths right away in their mind, just boom, 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 knock them out one after the other. So the first is, listen, you can get all your nutrients. There's no nutrient deficiencies that we really need to worry about here. You can talk about B12 a little bit later, and maybe DHA and omega-3s a little later, but really in general, you can get all the nutrients that you need straight out. And this is the official position of the largest nutrition academy in the world. So all that is immediately just dispelled. That, listen, it's okay. You can eat 100% plant-based diet. Then I explain to people, why do we eat animal-based foods then? Convenience, habit, culture, and taste. Not for nutrients. Not for nutrients. That's it. And so that knocks out a lot of their resistance to a plant-based diet initially. And then they go for the protein, and you could say, all right, if there's no such thing, there's no documented protein deficiency in the medical literature, as long as you're getting adequate calories of whole plant foods, and you can give them this example, just 50 grams of protein from brown rice and 30 from broccoli. If you eat 2,000 calories right there, that's 80, because you could ask them straight out. When they say, I love this, this is my answer. Somebody says, where do you get your protein from? Which you're going to get this all the time. You want to hit them with so many things in a nice, polite way, and you want to answer lots of multiple questions while you're doing it straight out. So you say, yeah, that's a great question. I had that question too when I first went to a plant-based diet, because everybody thinks you need to eat animal-based foods for protein, but what you really don't. If you think about it, where do the animals get protein from? Well, they eat plants. But when you eat the animals, in order to get your protein, you're filtering your nutrition through the body of another living being. And that body adds cholesterol, saturated fat, not to mention antibiotics and growth hormones. Why filter your nutrition through the body of an animal? Eliminate the middle moo and go straight to the plants, go straight to the source. And really, when you think about it, the strongest animals in the world are elephants, rhinos, gorillas, and horses, and they're 100% herbivorous. And I heard that the strongest man in the world, Patrick Boumovian, he can bench press 750 pounds, and he's been 100% plant-based, and there are lots of other athletes that do it as well. So they clearly get their protein. So, all these athletes, Tom Brady, Aaron Rodgers, Kylie Irving, and there's the strongest man in the world right here, Rich Roll, Scott Jurek. And so tennis players, so many people do it. Boom, you just knocked out with that one answer that you can get all your protein, and it's just all the answers. And they go, wow, I didn't think about that. And one other thing that you could say to them is, do you know how much protein you really need to get? And they'll always look at you because they ask you, where do you get your protein from? But they don't know how much protein that they really truly need. A woman only needs about 45 grams a day, man 55 grams a day. That's not much. That's not much at all. I can get half of that for breakfast with my oatmeal, put some pumpkin seeds on there, and use some soy milk on there, and you've got half your protein for the day already. It's crazy. So they don't know how much. So, oh yeah, you only need 45 grams a day for a woman and 55 for a man. And I could easily get half of that just in my breakfast with some oatmeal. It's pretty easy. And so when you say it that way, that really does help out. And so one of the other things I hear people say about the protein question is you say, the question shouldn't really be, once you kind of wrap all that up, you lead into the next thing, which makes them think, is you say, hey, listen, the question shouldn't be where do you get your protein? It's where do I get my protein? That is, because that's clear, I can get it. Where do you get your fiber in your diet? Because a very small percentage, I think it's 3% or less of Americans actually get the daily recommended fiber. And fiber only comes in plant-based food. So you should really check how much fiber you're getting in your diet. Make sure you're getting enough fiber, obviously saying in a polite way. So it's kind of a comeback to make them think more about it. And so the next misconception is, oh, there's no food to eat. What am I going to eat? Well, look at these. Look at this. It's crazy. That's when you say, oh yeah, I could still eat burgers and curries and pastas and spaghetti, whole wheat noodles and stuff. There's over 100,000 edible plant species out there, and the food tastes great. And people say, no, the food doesn't taste good. What are you talking about? I've had these stuff. It tastes like cardboard to me. And then you explain to them how your palate is tuned into the sugar, salt, and fat, and your taste buds are so tuned into that way that when you eat this way, it might not taste good at first, but your palate will adapt. And then you will finally, as you eliminate sugar, salt, and fat, excess fat from your diet, then you're going to all of a sudden start tasting these good, healthy foods, and you're going to enjoy this food and love it. But it might take 2 or 3 weeks or so to make that change. But if you show them pictures, oh, look what I had for dinner. Always have like some pictures of what you ate, some phenomenal looking food. Look how good this is. And, and they'll see it and say, I could eat that. I could eat that. This looks good. And it could be the example. Be the example yourself, and that will be powerful. So that helps to put that misconception out. Then the last misconception that I think is super important to make sure that you mention to people, and I mentioned this as well to my patients, is everybody thinks moderation is good, right? Everything in moderation, right? Including moderation. And I say this straight out, that no, you shouldn't smoke cigarettes in moderation. You shouldn't do heroin or cocaine in moderation. You shouldn't eat unhealthy foods in moderation. Unhealthy food should be 0. So I say that straight out. Granted, if you smoked 1 cigarette a month, is that really going to hurt you? Probably not. But you know what? Then you start becoming in tune with the taste of the cigarette and the nicotine, and the addiction comes right back again. So don't let yourself get into that. Very few people have the willpower to do something like eat a processed sugary thing once a month, or smoke only 1 cigarette a month. If they used to be a cigarette addict or an alcoholic, or used to be an alcoholic, oh, I could just once a month have a 6-pack of beer. No, you're going to get addicted right to it again. So it's just, bad things should be 0. They should be 0. No processed food. No animal-based foods. Focus on whole plant foods and keep it there. If you want to go all out and have yourself a great cheat meal, do it by adding more of the healthy plant fats in there and more fruit. Maybe throw some dates, make it sweeter, make yourself a good whole food plant-based dessert. But don't go all out saying, once a month I'm going to eat a whole cake, or I'm going to go and eat something that's completely wrong, because the cheat meals is just not a good concept. So moderation doesn't work. Bad things should be 0. So what I love to use this analogy with my patients, because people are thinking, okay, fine. All my misconceptions are gone now. I know I can get all my nutrients. I can get all my protein. I know the food can be good. It might take some time for my palate to change. Man, but this is going to be a hard journey. How the heck am I going to do this? And I say, well, you know what? You got to think of it as it's a skill, right? It's a whole skill that we have lost as a culture, that we have lost is how to cook good, clean, healthy food. I say, it's no different than if I told you right now you need to learn how to play the guitar. So listen, you just had a heart attack. You're high risk for another heart attack. You're 300 pounds. You have uncontrolled diabetes, high blood pressure, high blood sugar, cholesterol. You need to lose weight. And you need to do it, relatively quick. And yeah, you might be okay for a year or 2, but the longer you go, the higher your risk. So if I told you straight out that if you learn how to play the guitar and learn how to play it really well, that you're essentially guaranteed to not have further health problems, and you can get off a lot of your medicines, feel great, live longer, live well, what are you going to do? You're going to say, okay, doc, I'm going to go get a guitar and I'm going to learn how to play the guitar, right? So somebody goes, buys a guitar, they take lessons, whatever. But, you can't just watch one video, watch one documentary, like, Forks Over Knives is for health. You can't watch one guitar playing documentary and boom, you're a good guitar player. It doesn't work that way. You got to work at it. You got to take lessons. You really, really got to work at it. And if you do, eventually, after 1, 2, or 3 years, you'll be a good guitar player. Now, the same thing happens for food. You can't just watch Forks Over Knives and boom, I'm on a whole food plant-based diet. I'm healthy. My diabetes is reversed. I'm going to lose weight. This is great. I guess a few people can. If you're really highly motivated, people can go into all the stuff out of the pantry, out of the refrigerator, and they're on a whole food plant-based diet. Most people just can't do that. And so if you can, great. If not, most people can't. So you got to learn. You got to learn the recipes. You really got to cook. You got to work at it. And if you really, really work at it, you'll get there. You will. But it might take you 1, 2, or 3 years. But I love this analogy because I tell people straight out, what you cannot do, though, is let somebody else play that guitar for you, which is a fad diet. That's like a keto diet or going on some crazy, 30-day or 60-day juice fasting, or buying food from somewhere, just buying food from Jenny Craig or Nutrisystem. Those don't teach you any skill. That doesn't teach you the lifestyle that you need. That lets somebody else do the work for you. Somebody else is playing the guitar and you're sitting there listening to the music, right? But you're not learning anything. So the second you're done with that, say you go on Jenny Craig for a year, you lose some weight, things are great. Now Jenny Craig says, okay, here's your guitar, and hand you the guitar, and you say, I never learned how to play this. I didn't learn the skill. You'll gain all the weight back. That's not what you want. So you need to learn the skill yourself. So play the guitar yourself. There's no quick, easy way to learn the skill. So I use that analogy to people, and they tend to understand that, and they tend to get it. Then we get into this. A plant-based diet is the only diet that can reverse heart disease. I show them these pictures, and I tell them there's good, solid evidence for it. And I go over the fact that animals out in nature, like monkeys and rabbits, they eat their bananas and carrots, and they have completely clean coronary arteries. Not a speck of plaque builds up. However, kids as young as the age of 3 have cholesterol plaque building up. And we know that the default state of the human body is health, right? The default state is health. The human body only clogs up and becomes sick if we actively do something to it. If we eat cholesterol, saturated fat, sugar, smoke cigarettes, remain sedentary, then we damage the arteries up. But the default state of the human body is to be healthy. So the concept of adding a pill, adding a supplement, adding a stent, adding a bypass surgery is a wrong concept. If we just remove the thing that's causing the harm, then the body will heal itself up. Just like if you cut your hand and do nothing, it will heal up. But if you keep cutting your hand in the same spot, it'll never heal. Same concept. I make sure people understand that concept. Remove the cause, the body will heal. And it is a bit of a spectrum. The closer you get to a plant-based diet, the healthier you're going to be, away from the standard American diet on the left towards a whole food plant-based diet on the right. However, the magic happens, at least 90% of calories from unprocessed plant-based foods. The best is 100%, no question about it. So I go through, I show patients literally these slides of how the plaque slowly builds up, and then you can clot your artery, and that's what triggers a heart attack. In that 1 out of 3 to 1 out of 4 people, the first symptom of heart disease is sudden death. So you really, really need to prevent heart disease from developing in the first place, which is why we need to focus early, getting our total cholesterol under 150 and our LDL under 70 if we can, just through diet and lifestyle, not with medications, because that is super important. Doing that as young of an age as you possibly can, from hopefully early childhood. I go through with them dietary cholesterol is only in animal-based foods, and there's no dietary cholesterol in plant-based foods whatsoever. And then I show them things like look at these graphs where the cholesterol comes from. The chicken and beef are almost the same, right? But fruits and vegetables, there is no cholesterol in plant-based foods. And then we talk about saturated fat, that 95% of saturated fat comes from animal-based foods. And I show them this graph, and we go through, look at how much saturated fat is in butter, and look at how much is in all these oils compared to plant-based foods. We really need to get our saturated fat down to nothing. It's not an essential nutrient. So it's important that they see the comparison of butter and cheese. Cheese is the #1 source of saturated fat in the American diet versus plant-based foods, and how bad the oils really are for you. So understanding that nutrition aspect is important. And again, to put the moderation thing at rest, there is no safe amount. The Institute of Medicine didn't set any limit for how much saturated fat or cholesterol you could have, because any intake above 0 raises your blood cholesterol levels. Any intake. So 0 is the best. There is no moderation that we should be doing. It should be as low as we possibly can for cholesterol. It should be 0, which is a plant-based diet. For saturated fat, it should be as close to 0 as you can, which again is a whole food plant-based diet with no oil in it, because even olive oil is 15% saturated fat. Just like you shouldn't smoke cigarettes, don't eat cholesterol, and don't eat saturated fat. And I compare to them the refined carbohydrates versus animal-based foods. They both lack fiber, They both are high calorie density, they both spike the insulin, and they both cause diabetes. So a lot of people argue, oh, it's the bad carbohydrates that's the problem. No, it's the animal products that's the problem. Well, they're both bad for you, right? But hey, look, animal-based foods have cholesterol and saturated fat, animal protein, heme iron, TMAO, which is a whole different topic, nitrates, antibiotics, it increases IGF-1. Animal-based foods seem like they're much worse to me than refined carbohydrates are. They're both bad, though. It's like saying, what's worse, heroin or cocaine? They're both bad. They should both be out. And what are you left with? A whole food plant-based diet. So it's important to understand that concept. The refined carbohydrates are just like eating sugar. You know, it's so bad when people are eating a refined white noodle. It's just like you're eating sugar. And we always know the whiter the bread, the sooner you're dead, right? So you say those little things and people remember that. The whiter the bread, the sooner you're dead. And so if they have some white bread in front of them, they might be like, oh, I remember you said the whiter the bread, the sooner you're dead. Oh, geez, maybe I should eat this. So those types of things stick in people's minds. I go through the importance of no oil, the most calorie-dense food, even olive oil is 14 to 15% saturated fat, highly processed, causes endothelial dysfunction. I make sure I knock out that misconception that oil is healthy for you, especially olive oil. So this takes time, of course, but it's important that they understand this. I go over calorie density. I show this slide where on the right, 400 calories of whole plant foods fills your whole stomach. On the left is 400 calories of oil, barely fills you up. And look at cheese and meat, 400 calories barely fills you up versus rice and beans, more starchy. Plant-based foods, still more than half your stomach is filled with only 400 calories. And those are very satiating foods. A more starch-based diet like Dr. John McDougall recommends, great book, The Starch Solution. And we show this spectrum of over here on the right that oil or pure fat is pure fat, and it's the most calorie-dense food in the entire human diet. When you compare oil to butter, yeah, butter has fewer calories, but butter has way more saturated fat and cholesterol in it, as we showed before. Nuts and seeds are very calorie dense. Granted, not all those calories are bioavailable. A lot feed your microbiome, but still, you got to limit nuts and seeds. Don't go nuts on the nuts. And sugar calorie density versus cheese and the refined carbohydrates. When you compare those to unrefined, when you look at all these, the fatty proteins versus legumes and fruits and vegetables, the average whole plant food is 500 calories per pound, and if you're eating 3 to 5 pounds of food a day, that's where you want to average, is around 500. And that's what will keep you. It depends on a lot of different factors, of course, but if you eat only whole plant foods, you're going to average a calorie density, which is what you want to maintain good weight long term. I show them that the food plate that we really want has water in it compared to dairy, and the protein should be legumes. We shouldn't leave it as just protein, which could include animal protein according to the USDA. We want to keep it at plant protein, right? Whole food, plant-based diet, and I make sure that people understand, eat the whole food, plant-based, not a vegan diet. It's important because a lot of people, especially read the research, oh, vegan diets aren't necessarily healthy for you. That's because a lot of vegans might be eating this. You ever see the Impossible Burger? It's heavy in coconut oil. It's a highly processed food, frequently put on a refined carbohydrate bun with plant-based cheeses on it, which might be oil-based. It's a lot of saturated fat in these things. It's not good for you. It's not a health food, right? So I make sure that that misconception is also taken care of. So when I say to my heart patients, listen, when we're doing stents and bypasses, we cause tens of thousands of deaths, tens of thousands of strokes and heart attacks as a complication. But lifestyle medicine and a plant-based diet, there are no deaths. There's no complications from it. So pbnm.org, as you know, is my passion. And this is what we're using to try to help change our system, to try to help get people to the resources that they need. Check out pbnm.org, go to resources. You'll find everything you need. Develop support groups in every single city in America where people can go into potlucks and talk to people and get lectures from doctors, get physicians involved, really bringing together community members and healthcare providers in order to really to be the change. So this says how I talk to people about it, about a plant-based diet. And I hopefully you learned a lot of these things, a lot of things that you can maybe go back and talk to people about. Now, one other thing that I wanted to say, and this is an interesting thing. I was talking to a doc a couple weeks ago, and what he said to me was, hey, listen, sometimes when I have a resistant patient that, some people get it, they're intelligent, they're highly motivated, they want to make changes, but a lot of the average person's like, I don't want a plant-based diet. What are you talking about? Sometimes you just say, please, just eat an apple a day. Just do that. And we just start simple. We start with breakfast. And I actually write down in the patient's chart, okay, I told him he's just going to eat oatmeal for breakfast, and we're going to stick to that. And I want him to do it 30 days in a row and eat an apple a day, simple things. And then I'll give him a recipe for a good plant-based lunch. Say, can you try this? And whatever. And slowly ease them into it. Some people, we have to do that. So, but this doc I was talking to, he said, well, when I'm trying to get somebody to stop smoking and they're having a hard time getting motivated to stop smoking, I will pull up, he said, in the patient's room, as we're there, I'll pull up some YouTube videos from, I believe it's the American, I don't know if it's the American Cancer Society, I believe, that shows these videos about what your lungs look like when you smoke, the tumors, the people with tracheostomies that are smoking through their tracheostomies, and all these crazy kind of graphic images of smokers and what can happen to you. And he said, you know, when I'm trying to get somebody to give up animal-based products and they're not buying into it, I say, I'll bring up the trailer for the documentary called Dominion, which is a documentary about animal rights and how we treat animals in slaughterhouses. And seeing that, again, is another thing that takes the blinders off. Where does your food come from? And it's graphic, and it's, I don't know, I rarely get into ethical discussions or whatever about plant-based diets with my patients, but I get that physician's point. I get his point. You know, if we want to do what's best for our patients, we want to get them motivated. And if showing them scary videos about smoking works and is advocated to help people stop smoking, well, showing people scary videos about where their animal food comes from, maybe that can motivate people to ditch animal products too. Whatever works. I really never done that before in my clinic. I don't think I'm going to do that, but still, it's an interesting thing. If you're trying to get somebody motivated to say, hey, just, you know, if you're struggling, just look at this one little trailer, and the trailer is pretty powerful. So that's kind of I think that's pretty much it. I think that's the way I say, you know. So when you're trying to summarize things, when you're trying to talk to somebody about plant-based diets, you must have all the answers to all the questions, and not only have the answers. So when they're asking you about protein, when they're asking you about iodine or omega-3s, that you have the answers, but you must do it yourself and be a good example. Put the oxygen mask on yourself before you help other people. That's so important for healthcare providers too, that healthcare providers must do it themselves before they recommend it to patients. So that's kind of my whole thing about talking to people about plant-based diets. And so let's go into some questions and answers. Let me pull up here the feed, and hopefully everybody's learning something here, and see what we got. So, all right. So if you fail to plan, you plan to fail. Susan, that's a great comment. I completely agree with that. That's definitely a good comment. The Pleasure Trap is a great book. Yeah, I think Brittany, yes, it is. The Pleasure Trap, it is what the motivational triad really goes over. And it goes through more than just diet and lifestyle too. It actually goes over, talking about other things like why it is that it's important to sleep well, and we interrupt our sleep and other things, but that's very good. I hope my kids have my aha moment before they have a health crisis. Yeah, you know, that's hard for me too. That really touches home to me, because I have a lot of loved ones and other people that I know that I want them to have their aha moments sooner rather than later. And again, lead by example. If you lead by example and slowly teach them how good the food is, they'll have their moment. Everybody will. Our country is becoming more and more common. We're going to hit the tipping point. And the way we're going to hit the tipping point is if everybody here learns the answers to all the questions, so that when people ask you something, that you know what to say to them. Lead by example. More and more people have their aha moments. And as the masses move more towards plant-based diets, they're going to hear it from somebody else. And they might not want to hear it from you. You know, one of my good friends, if he hears it from me, whatever, okay, sure, fine, whatever. But then all of a sudden, he hears it from somebody else, and he sees somebody else thriving too. And the more people you hear it from, the more that we get into this, the more influence that potentially we're going to have. So it's super important. And this is one of the other things that I talk to my patients about is I say, you know, because again, everybody's different. I ask them that question. Why is it that you want to be healthy? What motivates you? What is it that you're looking for in your life? If you say, listen, doc, I don't care if I die when I'm 70. I just want to like party and enjoy life while I'm here. So give me some meds and throw some stents in me. all right, I wish I didn't have that mindset. And I kind of slowly ease them in and say, yeah, but you can live longer and have a good quality of life. And that's when I do go through a lot of those things. But really finding people's triggers, finding what they want to do, and getting their family in that discussion, having them come in too, is a super important thing. So, Brittany, the problem of getting the word out is that you're fighting against what medical doctors with degrees are telling their patients. Hey, so thank you for leading me into what I wanted to talk about next week. I wanted to do a little talk and Q&A about why doctors don't recommend plant-based diets more to patients, and get into this, not only the science behind plant-based diets and where doctors are lacking in understanding the science, but all of their preconditioning and all those reasons. And I did a podcast with Ian Kramer, great podcast, Ian Kramer podcast, and he asked me that question straight out. And when he asked me that question, why don't more doctors recommend this? What's going on? Why didn't I learn this more? And I was like, whoa, there's a whole bunch of things going through my mind. There's a huge list of reasons as to why it is. And so next week, I was going to do a little talk and presentation here on this Facebook Live about why it is that more doctors don't recommend plant-based diets, why they don't follow it themselves. And there's a long list of things that we're going to discuss. So I get it though, Brittany, when you're trying to talk to people about it and they say, listen, my doctor didn't tell me this, so I need to eat animal protein before I work out. Yes, I see what you wrote here. Well, there's a funny little picture that I saw where the one person says, my cardiologist says that I have to eat meat. And then the person on the whole food plant-based diet says, I don't have a cardiologist. I don't need one. See, that's the difference, right? It's the preconditioning, it's misconception. So we're going to get into that a lot more next week. So when people say, my doctor told me that I need to eat animal protein before I work out, or whatever the case is, it's so frustrating. Medical doctors, they need to be honest. My father's cardiologist told him he would be fine for the rest of his life after successful triple bypass surgery, not to worry anymore. That is absolutely frustrating. In my opinion, that's almost medical malpractice. Honestly, I've had people come to me that were told by their cardiologist, eat whatever you want when you have a heart attack and you clog up, we'll fix you. That's medical malpractice. Because again, you don't know when somebody's going to have sudden death. You can't do that. Now, granted, again, if your total cholesterol is under 150 and your LDL is under 70 and you're consuming a little bit of animal product, you're probably very well protected. But you know what? The average American's cholesterol totals around 200, and the average American's LDL is like around 125. So a vast majority of Americans need to eat predominantly or exclusively plant-based to get their total cholesterols under those numbers. And so for a cardiologist just to say ignore diet and ignore lifestyle, it's like no different than saying, go ahead and smoke some cigarettes. You can smoke. Don't worry if you smoke, you get lung cancer. We'll take care of it, right? Yeah, if you need oxygen, we have oxygen. It's easy. We can put oxygen on you when your lungs stop. No, absolutely not. So that's actually ridiculous. And I think that that's actually should be considered medical malpractice. Just like we were having a Twitter debate recently about keto diets or low carb diets, how there's short-term science to support them. And we could do this as a topic one of these times too. There's short-term science to support weight loss and biomarker improvement, but long-term increases cardiovascular risk and long-term increases all-cause mortality. So if a doctor really recommends somebody go on a low-carb, high-fat diet or a keto diet long-term, that's medical malpractice. So if somebody goes on one and has a heart attack, could they be liable? Could the physician be liable that recommended that to them, especially if they did it long-term? I think that's possible. I think that's definitely possible. So it's important that doctors need to give evidence-based advice. We can't go telling people to do things that have solid evidence that they're actually harmful for you, right? We just can't do that. So let's see. I'll pass on the meds. So I'll pass on the meds and stents. They didn't extend my parents' lives. My mom didn't live long enough to get her stents. She died 2 days before the scheduled procedure. Oh, geez. Well, you know, honestly, that sounds, I'm sorry about your mom, Susan, and everything, but one way to think about it is elective stents, elective fixing of clogging, does not save lives. It does not prevent heart attacks or strokes. It does not prolong lives whatsoever. When we put in stents during heart attacks, yeah, it can save people's lives, but when somebody has a little bit of chest pain and they're clogged and they're getting a stent, it's not a life-saving thing. So who knows what happened? In regards to your mother, and there are nuances in certain instances where maybe stents can be important electively, but that's usually the exception. So sorry about that. And Judy, yeah, I love that statement, and I'd love to say something about this. So heart attacks are the leading cause of deaths for cardiologists. That's true. Heart disease is the #1 cause of death in America, including for a cardiologist. The president of the American Heart Association was giving a talk at a National American Heart Association meeting when he had a heart attack up on the podium. And Dr. Kim Williams says this all the time, is that, again, this is all coming down to, we need to take care of ourselves first before we can take care of others. We need all cardiology fellows in training, all doctors in training in general, must have their total cholesterol under 150, their LDL under 70. We need to do it by diet and lifestyle. We need to be the example so that we can say, listen, we need to change our system, our culture more towards lifestyle medicine. It's super, super important. So yeah, that's definitely the truth. So yeah, thanks for joining me here. And I hope you guys learned a little bit, but it's just, again, you need to know all the answers to all the questions about plant-based diets. And it's nice to make a blanket statement like the American Academy of Nutrition and Dietetics says it's appropriate, because that answers all the questions, but they still might have some individual questions. So be knowledgeable, know all the answers, have it ready, show them great pictures of food that you eat, show them the strongest athletes that get all their protein, show them the data of reversal of heart disease, and then also make sure you know other things like, oh, what about keto diets? Know the answers of short term, you could get some benefits from it, but long term, the risk is super high. And what's the point of doing something short term? You need to do it long term for the rest of your life. The whole play the guitar thing, learn the skill for the rest of your life. You want to live, you say, hey, do you want to live good for 2 or 3 years, lose some weight, or do you want to maintain it long term? If you want to maintain it long term, you just need a healthy diet and lifestyle, and you need to learn how to do that the right way. So, yeah. So I think that's it. I don't think I missed anything. I show people one of the things I didn't talk about is I show people a graph from the USDA. It's a little pie graph, and the pie graph shows that the average American eats only 12% of their calories from unprocessed plant-based foods, 63% of calories from refined carbohydrates and oils, and 25% from animal-based foods. And I show them that pie graph, and I say, you need to increase that green portion at least to 90%, and just so that people understand, again, the horrific state of health that we have in America. So, yeah. So if somebody says they don't care about their health, they don't want to, they'd rather die than eat a plant-based diet. I've had people say that. And so then that's when you just have to say, well, what are your goals with your health, with your life? Get them to make baby steps, just eat more plant-based. But really, I do feel obligated, and this has become a huge thing for me. I feel just absolutely obligated. Every patient with cardiovascular disease, I must tell them about the power of a whole food plant-based diet. This is so darn important. So, well, thanks so much, everybody, for joining. Oh, let me see if there's any other questions here. Not a question, but what'd you say here? But a tip, the most interest I've gotten whole food plant-based, when I shared my before and after pictures on Facebook. I share how I did it. I bought a bunch of Forks Over Knives, sent you 2 books from the bookstore, very cheap. When people asked me about it, I would explain to them and give them those books. I told them to message me with questions. That's great. You're being a great active advocate. Show that, and Forks Over Knives has a great success story thing on their website. So let me show you something interesting for those of you who don't know that haven't heard my personal story. Here is the Forks Over Knives app. I don't know if this is coming out good. There's a Forks Over Knives app, and if you click on resources in the corner, who's that guy up the very top there? That's actually me. That's my success story. So that is I've lost 100 pounds on a whole food plant-based diet, and you can click on that on the website of the app and read my story. But yeah, it's certainly important to show people those things and how you could thrive on it. And about giving people books and stuff, I've tried that before with my patients. Maybe it's different if you're really engaged with somebody and you see that they have genuine interest. My experience is 75% of the patients I've given books to, they haven't even read them. They just, I don't know, it's hard. And so that's why with pbnm.org, we're setting up these group meetings and these regular monthly potlucks. So I could say, hey, listen, right over here, right upstairs on the 2nd floor of our building, we're meeting monthly and we're talking about this. We're having a whole food plant-based no oil potluck, and don't worry about cooking food. Just show up, eat the food, talk to us, see it, and slowly get yourself into it. So having those resources in place so that Brittany, so if you have a PBNM group in your area, you could just say, hey, listen, just come on out, whatever it is, Thursday night, and then we'll eat some food together with this group, and there's going to be a cardiologist there, or there's going to be whatever to talk about it. So just Just hang out. It's free. You don't need to pay. You'll meet a bunch of other people who are trying to help improve their health and lose weight and other things too, and you'll get to taste a bunch of the food. So that type of a support system is really what we need to be the difference, to be the grassroots effort. And so that's super important. So Judy, how long are you debilitated before dying? Yeah. So that's the whole thing, is our current healthcare system is very good at adding years to your life, but we don't add life to your years. And so that's a good thing to maybe motivate people. You know, some people might say, listen, my parents lived into their 90s and they were fine until they were 90. Okay, but you know, you're much more likely to have a debilitating issue and be stuck in a nursing home on 30 pills if you don't take care of your health. Maybe your parents did okay, but you know, are you going to? Because a lot has changed since your parents. You know, our diet changes. Your parents exactly the same as your diets, and is your genetics exactly the same? It might not be exactly the same as your parents, right? And so your risk of being stuck in a nursing home at the age of 70, debilitated on multiple medications, not enjoying life with your marbles, not being intact, is much higher if you don't take care of yourself. So that's a great point, Judy, that you could tell people about why it's important to take care of yourself now. So yeah, people, when they see this, that they're stuck in bed, they're having issues, they want to change. Yeah. So great. So join me next Monday. Next Monday, the topic is going to be, why is it that healthcare providers and doctors don't talk to their patients about plant-based diets and just in general about lifestyle? Why is it? And if we go through all the reasons as to why, and we kind of, just like, you know, talking to people about the nutrients in plant-based diets and why they don't follow their own plant-based diet, let's go through why doctors don't recommend it. And if we go through why doctors don't recommend it, then hopefully we can find an answer for each one of those things, right? So if we can find an answer for why doctors don't recommend it for all these different multiple reasons, and what's the solution to each one of these, and we take those solutions and we grasp it and we try super hard to act on each one of those as a healthcare system, as a grassroots effort through pbnm.org. And if we can really, really change that, then that's how we're going to really affect change in our system. So, all right, I really appreciate everybody here. Thanks so much. Please share this video. Please like my Dr. Stephen Loam Facebook page. I'm still working out some technical issues and glitches on how to really do these Facebook Live things the right way, so that people, we can engage as many people as possible, and it's technically easier for people to hook up and see these things. So hopefully you enjoyed it. If you have any other tips or tricks or technical things you'd like to teach me, please message me privately. I'm going to also try to take these videos. There's a way that I can download them and put them up on YouTube, to start a YouTube channel with these too. So, and if there's any other topics that you guys are interested in, please let me know. What I'm thinking is for January, we're probably going to take a break 2 weeks from today towards the holiday, and probably 3 weeks from today as well. But starting in January, weight loss will be a great topic to go over, calorie density and things like that. And then in February is going to be heart month. So, hey, let's get big into heart disease. We'll talk about, go through heart disease prevention reversal again. We'll go through cholesterol in much more detail than what we went through last time. And we can talk about hypertension and all the different factors about blood pressure. So if you know other people that have questions about that, we can do that as well. So thanks again for joining me, and we'll see you next time.